Let's talk about the fifth variant of concern, and India's tally totally has now crossed the 200 mark. Sources have said that the Prime Minister is going to be holding a key meeting on the COVID-19 situation tomorrow. The centre has issued directives to states. In a letter, Health Secretary Rajesh Bhushan had asked states to step up measures to contain Omicron spread. The centre has advised states to activate war rooms, impose night curfews if required, and carry out door-to-door searches. Centre has also asked states to enforce home isolation and accelerate measures to ensure 100% vaccination. Jammu and Kashmir and Odisha have recorded the first cases of Omicron variant yesterday. The potentially contagious strain has now reached 14 states and union territories. The advisory of the Health Ministry comes at a time when states like Karnataka, Maharashtra, Goa and Delhi have imposed stringent measures ahead of the New Year's festivities.
Omicron is a new variant, and we know that the virus will continue to mutate and new variants will emerge. It is causing, as per the data that we have, because most of the cases currently are from the Western world, from UK, Denmark, South Africa. There it is causing a mild illness. Hospitalizations are not much. We need to have more data as it evolves in terms of the hospitalization and severity of illness. Currently it is causing a mild illness. And in terms of symptoms, they are more or less the same. Majority of people have mild symptoms in the form of fever, body aches, sore throat, running nose and cough. But otherwise, severe symptoms are not usually being seen in these patients.
Omicron-led third wave likely to hit India by February. Well, this is a warning, essentially a projection that has been made by experts who are in fact studying the trajectory of the pandemic. And this puts things into perspective. It indicates that the pandemic is not over yet. Take a look.
When will the third wave hit India? And how bad will it be? These are the few questions baffling epidemiologists for a while now. Latest projections by the head of COVID Supermodel Committee, Vidya Sagar, and IIT Kanpur Professor Manindra Agarwal suggest the third wave may unfold by February. The projections suggest India is likely to witness around 1.5 to 1.8 lakh cases every day by the end of February. The only silver lining in all this is that this wave is likely to be less severe than the second wave that was driven by the Delta variant. The fall in cases after hitting the peak is also expected to be quick. Projections also suggest that hospitalization will be low since a significant number of Indians will be fully vaccinated by then.
The most pessimistic scenario, which is you have totally lost any vaccine protection and the natural immunity due to prior exposure to Delta is eroding very quickly, we foresee a peak of something like 1.5 to 1.8 lakh cases per day happening somewhere towards the end of February.
Okay.
These projections are made keeping in mind the Omicron threat. In South Africa, the COVID cases, after peaking in mid-December, are seeing a sharp decline. The average daily deaths were less than 50 during the peak.
A very, very sharp peak, very quick rise followed by very sharp decline. Again, as Professor Agrawal has pointed out, we can look at South Africa as a model. They had peaked in just under 3 weeks. And now, the number of daily cases in South Africa is 33% lower than the peak. So that means a sharp drop in cases in just 1 week's time from the peak.
But with Omicron cases rising to over 200 in the country and over 5,000 new infections being reported on Tuesday, the picture can change rather quickly. With Sneha Murdani, Bureau Report, India Today.